element of misinformation. So another example of very alarming um, misinformation is, or you could say disinformation, is Juul, right? Is the vaping industry. So the vaping industry has posited itself as like a healthy alternative to regular cigarettes. And even worse than that, there's lawsuits alleging that they were marketing their products to youth and children. So of course the vaping industry would argue, oh no, right, all these colors and flavors and these teenagers in our marketing campaigns. That's just a coincidence. We weren't actually trying to market towards children, or we weren't making any claims, right, of saying that vaping was somehow a better alternative to cigarettes. But of course, this is not new, right? A corporation, right, misleading the public. It turns out the predecessor to big vaping is big tobacco. And in the 40s and 50s, they were also targeting children in their advertising. Check out the Kool-Aid cigarettes here on the left. Or sorry, it's the Kool-Aid beverage. I'll bring up why we have that imagery there in a sec. So they were targeting children in their advertising, grossly misrepresenting the health effects of smoking, and even getting barred from targeting children for cigarette sales. So they actually got caught. So why do I have the Kool-Aid packets here on the left? The reason is because they actually decided, hey, if we can't sell cigarettes to kids, we need to diversify our industry, our holdings, and they began focusing their marketing on young people by selling sugary beverages. So they actually are responsible for starting the sugary beverage industry, such as Kool-Aid. So they're like, hey, if I can't make money off of cigarettes with children, let's make money off of sugary drinks. So again, big tobacco totally doesn't care about your health, right? Totally doesn't care about corrupting or hurting children. And again, misrepresenting themselves. Here it says, that doctors recommend a particular brand of cigarettes. There's many, many examples of marketing like this, where it has a doctor actually marketing cigarettes, which again is a misrepresentation. It's trying to tell people that, hey, smoking is not only safe, but this brand in particular is recommended by a physician, which, as we know now, of course, right, smoking, obviously cancerous, can kill you. Definitely not something you want as part of a healthy lifestyle. So before wellness influencers, right? So another example of misinformation. So now we have people selling supplements, flat tummy teas, detoxing techniques, fad diets, celery juice right there, that example. That brings me back to when my parents had this little cafe, and we would sell fruit juices. And for weeks on end, we had people just coming in asking for celery juice specifically. And they would pay way too much money for it. And the idea was that they were somehow going to lose weight. As we know, the only way to lose weight, right, is to lead a healthy diet, a healthy lifestyle, consuming, right, high nutrient foods, avoiding, right, foods that are processed, that are extremely high in calories, and of course having a balanced diet. But all these wellness influencers, which is $1 billion industry, by the way, the wellness industry, they'll try to convince you that, hey, just drink this, just eat this, just do that, just do this one thing, and boom, your entire like health, right, is going to be top notch, right, and you don't have to do anything else. So before that, it was actually this snake oil salesman. So let's watch this video.
The original snake oil might just have worked. It all started in the 1800s. While working on the Transcontinental Railroad, Chinese laborers used an oil made from the Chinese water snake that they believed would reduce the inflammation on their sore and tired muscles.
Word spread of the healing oil. American salesmen looking to get rich made their own, but they used rattlesnake, which didn't have the same medicinal properties as the Chinese water snake. But when the salesman added some alcohol and a little opium, folks couldn't get enough. The salesmen peddled their snake oil at vaudeville-style medicine shows. At the 1893 World's Fair in Chicago, Clark Stanley, the Rattlesnake King, took a live rattlesnake, sliced it open, and plunged it into boiling water to extract its oil. The crowd went wild. Little did they know, Stanley had stopped adding real snake to the snake oil he was selling. The number of medical cure-alls for sale grew, and ads started popping up in newspapers for countless other concoctions, claiming to treat everything from hair loss to skull fractures. But muckraker journalists were skeptical and began to report that snake oil and the other untested cure-alls caused addiction, overdoses, and deaths. In 1905, Collier's magazine published a series of scathing exposés calling them the Great American Fraud. The public outcry that followed led to the passing of the Pure Food and Drug Act and the creation of the Food and Drug Administration to protect consumers from unsafe medication. But modern-day snake oil cures still exist, and you can visit consumerreports.org to learn more.
As the video points out, right, these things still exist today. So before the wellness industry, there is actually it's snake oil industry, right? So these were again, like the video said, promises, right, for miracle cures, right, for everything that you can think of. And not only was it over promising, right, the effects of what was a medicinal use in Asia, they weren't even actually using the correct ingredients, right? They couldn't source the actual snake oil, so they made up their own. And then they threw in all kinds of stuff like opium, right? So it was going to have some effect on people, but it was definitely misrepresenting it. And that led to the Food and Drug Administration. That led to its formation, which helps prevent consumers, right, from being taken advantage of by these snake oil salesmen, and in the modern age, right, by the wellness industry. So you'll notice that sometimes it says, "Oh, like this is um, this is not approved or does not will not give you like any health outcomes," right? Sometimes you'll see some small print on certain wellness products, on certain supplements. That's because the FDA, right, does not approve of them promising certain health outcomes from using those supplements or, for example, flat tummy teas. So if it doesn't work right, if it's not FDA certified, then it's probably a good idea to stay away from it. You can, in a great capacity, right, trust what that department is recommending to the public. So yeah, wellness industry, modern, snake oil, historical. Long before the anti-vax movement went viral during the COVID-19 global pandemic, let's watch this video on that. So right there, right, we'll watch actually a full video. Next up, so this is just a quick little clip, right, of people protesting vaccines during the pandemic. It turns out this is nothing new, right? The anti-vax movement is actually older than you might think. So the first example from history is the AIDS denialism during the HIV crisis. So again, bringing up that HIV crisis from the 1980s.
Have a definition of AIDS.
For Dr. Anthony Fauci, the epidemic was a turning point. In 1984, he became the nation's top infectious disease expert, the same job he holds today.
Yeah, so you might recognize that figure there. That's Dr. Anthony Fauci. So he spearheaded the effort, from the government to defend the country from the HIV/AIDS crisis. He was also right at the forefront in leadership during the COVID-19 pandemic. Sorry, so an expert in two very critical outbreaks, right, in the U.S. And for some reason, he was actually quite he was a source of quite a bit of hate during the COVID-19 pandemic. Because of his recommendations, right, for social distancing, for wearing masks, and sometimes as they were figuring out the virus, right, sometimes gave mixed information. He became the target of so much hate because the virus became political, and we'll talk about that in the next lesson. But even before the HIV/AIDS crisis was the Anti-Vaccination Society of America. So this is late 1800s, early 1900s. So they had the same playbook as the modern anti-vax movement. So they would make emotional appeals. They would rely on fake science. But instead of using tweets or posts online, they would distribute pamphlets similar, right, to the Reformation, right, the Catholic Church, exchanging disinformation. So yeah, all of this misinformation that we think is new, that is a problem now, has probably has a counterpart, definitely some at some point in history.